We're in Japan this week to learn more about their universal healthcare system and how they have virtually no healthcare wait times. Come on, let's go find out.
The wait time is not very long. Basically, no wait time.
Do you have any wait times that are measured in years?
Not particularly.
How long waiting time while in Canada?
Sometimes a year?
Sometimes a year.
Yeah.
Year.
Yeah.
Well, that's really interesting. Colin, thank you so much for joining me today. I want to see this documentary and I want to share this with everybody. This is something kind of close to my heart. Japan is my second home. And well, healthcare is something that we all need in our lives. Can you tell me what brought you to bringing this documentary and putting it together?
Yeah, well, listen, thanks for having me. We've actually profiled a couple different countries' universal healthcare systems. I mean, the big problem in this country is that for so long, healthcare discussion it's kind of been framed by people that don't want to see anything change because they got a lot of control on the system right now. So they frame it as sort of like the two flags behind you right now. They present this option to Canadians that we either have our system and all its faults, or we have the US system, which is terrible and everyone's dying and it costs everyone a fortune. I'm not saying that's right, but this is sort of what the picture that people paint, right? And it's a way to try and kill healthcare discussion or healthcare reform discussion because, a lot of Canadians just simply don't want the American system. So what we've been trying to do is show people like, look, there's a lot of other countries that have universal healthcare systems that are performing much better than our universal healthcare system. So let's look at those countries. Countries like France, we went there last year. We went to Sweden 2 years ago. And this year we went to Japan to show their system.
Well, most people don't know that, Canada is probably, I think it's the only country in the OECD that has a universal healthcare, but doesn't have a private option. Nobody has a choice. You're stuck with that system. In fact, you brought up the dichotomy there.
Yeah.
America is our private option, and a lot of people use it. And apparently it's actually illegal to do that. But most people just kind of overlook that. You're surviving, so whatever, they're not going to come after you. But in Japan, they have a bit of a different system. And it is like a bit of a private option with the universal healthcare insurance sort of scheme. Can you tell me more about it?
Yeah, so it was culture shock for me. I mean, like you, I lived in Japan 20 years ago and I was young at the time, so I didn't really need the system too much. So this time to go back and learn about their system, it was culture shock for me. It was going into a country that I was very familiar with, but the culture shock was learning about just how good their system is. So the way it works in Japan is pretty much everyone's covered. And what happens is the government says to basically anyone who's in the healthcare market or wants to be in the healthcare market to provide services, they say, okay, for each service, here's how much we're going to pay and here's how much the price is. So then, if you want to enter the market and provide that type of a service, the government's going to give you that much money and you know what the price is. And so it's very different from Canada's system where the government tightly controls in this country. And you alluded to this, Clyde, who can actually deliver healthcare. And here in Canada, you're right, we largely outlaw private healthcare. It's kind of a weird way, like we're in Quebec, you have a lot of choices in terms of private healthcare. In the rest of the country, largely your option for private healthcare is you can go to another province and pay. You can't pay in your own province, which you're right. No other nation really does this in the developed world. It's backwards. It doesn't make any sense. But all that to say that the government tightly controls who can provide healthcare in Canada. And so go figure, you end up with long wait lines. In Japan, it's the opposite because, as I just mentioned, they set out the rules of the game. They say anyone, you can enter the market and start providing healthcare, provided, of course, that you have people who are, authorized surgeons and nurses and that, people that have the credentials. But you can open up. So you have government providers, you have nonprofit, you have some for-profit. And so together they all, know the rules of the game. Anyone can enter the market. It gives their patients a lot of choice. It doesn't matter which one they choose. The same amount of money follows them from the government and goes to pay the bill once they get healthcare. And they do have user fees in Japan, but everyone we talked to said, yeah, they're pretty affordable. They're like no real major concerns about the user fees. So one academic that we talked to at a university in Kyoto, he said if you're going to have a checkup at your family doctor, you pay, it worked out to around, I think around $28 Canadian. So it's not a huge amount of money. That is one of the differences between their country and ours. But what they do for major procedures, like if you're having heart surgery, I mean, that costs a lot of money. Canadians don't see the bill because of the nature of our system, but the actual cost for the government to provide that to you, it's a lot, be in the tens and tens of thousands of dollars. And so if you need something like that in Japan, they have a special cap depending on your income level. So a middle income Japanese person, when they got, if they got like heart surgery, the cap would be like around, it's $800 in a single month. So you'd pay a very, very small portion of the cost of this procedure. So the government protects people because they don't want the costs in that country to be, too out of control where it's unaffordable. So, I mean, that's one of the biggest fundamental difference between their country and ours is that they invite a whole bunch of people to open up healthcare facilities. And so they have a lot of healthcare, and the wait times are like pretty much non-existent. Like if you're having a serious heart problem, you're getting in right away. That's what the head of a hospital in Tokyo told us. That's what the head of a hospital in Osaka told us. We talked to a taxpayers group. We talked to everyday, Japanese people. They're all saying the same thing. Like you're getting in right away. No one's dying on a waiting list like they are here in Canada. And then if you look at things like, hip and knee operations, obviously serious too, but not the same as a heart procedure, not emergency. Same thing, you're getting in right away, maybe a week, 2 weeks. One medical director we talked to said, a month max kind of thing. So it's a far cry from Canada, where you often hear of people waiting 6 months just to see a specialist. Never mind getting surgery within a month. You're waiting 6 months to see a specialist, sometimes longer. And then once you see the specialist, the second wait time in Canada is, how long you actually have to wait to get surgery. And that's where you often hear, sadly, of people waiting a year, 2 years kind of thing for surgery. So it's a very different approach in Japan. And that, very fascinating to see.
Yeah, well, I can vouch for this through experience. My mother-in-law, obviously she's older, so she goes to the hospital for certain things. She's had to undergo surgeries, which were very comfortable situations for her. We went and visited her in the hospital when she had a surgery at one point, and I couldn't believe how nice, comfortable the place was. It wasn't crowded, nothing like that. Myself included. When I lived in Japan, I must have been like an allergic reaction or something. I had really inflamed eye at one point. And so I had to go to the hospital, and we paid our insurance.
Yeah.
We paid our premiums, which came every month, and you were expected to pay that. And it wasn't much different than MSP here in British Columbia before they went and just put it into the taxes, the provincial taxes. We used to have to pay premiums here. And it was actually really good service. When I went to see a doctor, I was seen right away, and then waited for a prognosis, and then here you go downstairs, go to the pharmacy and pick up your medications. And it was peanuts. It was dirt cheap.
Yeah.
It was all just generic options. It wasn't, it didn't feel like I had to go to another place or another facility. It was quite nice. And in fact, because of this experience that we've had, my wife and I, we do medical tourism all the time. When we have medical things that are of concern to us, we go to Japan for this. Yeah. And there's private options. Every so often we'll do a health checkup. You could go to these clinics. They'll be in an office building somewhere where they'll do an MRI. They'll do a bunch of like gastrointestinal tests. A series of these things. They'll check your whole body health. And as an outsider who's not paying the insurance schemes, you're talking like $1,000 to get all of that done in one day. These kinds of procedures that, I would get done in one day in an afternoon could take you months and months and months in Canada to make each appointment for each different test and go to each a different hospital. And it's just unbelievable how they've made medical so convenient over there. I mean, everything's convenient. You live there. You understand what I mean when I say that. But the medical system, they kept that same approach. Whereas in Canada, it's just like, what's really happening here? People can't get the service. If you get the service, you might die waiting.
Yeah. Well, we do as an organization report each year. We call it Died on a Waiting List, where we gather government data on patients dying on waiting lists in Canada. And last year was over 15,000 people. And that was, I was trying to be clear with the public. We're not saying 15,000 died because they waited, but these are people that waited for everything from cataract surgery to cardiac surgery. Cardiac surgery, obviously, you can die if you do not get your heart operation in time. And, some people, Clyde, they dismiss, cataract surgery, you're not going to die from that. I mean, even governments, they kind of use this language like that. But you can imagine if you've got cataracts and they're bad and you are no longer going out, living your life and being active. Instead, you're stuck in your apartment, living a sedentary lifestyle. I mean, that can contribute to other problems, which might kill you. Like, you're not getting exercise, so, causes problems for your heart or whatever, right? Then you do die. So yeah, we've got a big problem with, the worst case scenario, which is where you have patients dying on waiting lists. But, what you're describing about your experience using their system is what we saw when we were there. In this country, in Canada, it's often chaos when you go into a hospital. And I'm not trying to be critical of nurses and doctors. I mean, you got a lot of good people in the system that are working their best, but the system is set up in such a just nonsensical way, the way that things are run. So you have the left hand not talking to the right hand. You end up with that kind of confusion. You go into a hospital and ER in December, January, February, and during flu season, and the ER is crazy. You've got patients lying on stretchers in the hallways, people waiting half a day just to talk to someone. Like it's awful. But there it's the opposite. Like we went this, we had some meetings set up ahead of time, and one of the visits we did to a hospital that wasn't set up was with someone that we were talking to. He said, well, here, let me take you to the hospital that I go to. And we went there on a Sunday night, and the place was like a ghost town. There was like almost no one there. Like you could see there were a couple people in the ER, no one in the waiting room, right? Like very quiet. We went into the rest of the hospital. You could walk around. You could see where they had the section for I think it was orthopedic surgery. It's just all dark. The waiting room was dark. There's no one behind the door, resting there as a patient, because it's almost like they get all their work done during the week. Someone goes in on a Monday for their knee surgery or whatever, and then they're out by the Wednesday, Thursday, or whatever. And on the weekend, it's quiet. Like it's night and day different from how our system operates. But what I think is interesting for Canadians is that it satisfies, I would say, the three core criteria that Canadians want out of healthcare. They want everyone covered. You want to make sure that you're getting good quality healthcare in a timely manner, right? And when you're done, you don't want to face a major bill that's going to bankrupt you. And Japan satisfies those conditions. So, it's something that I think we want to be looking at, certainly more and more, just for ideas. Like I said, we've been to Sweden and France. There's ideas there too. But I mean, when you look at the chaos that's in our system, it's terrible. The good news is that there's so many better performing countries. We don't have to reinvent the wheel. We can look to those countries and say, here's what we got to copy. And in the case of Japan, like I said, the thing that we've got to change is this mindset where you've got the government restricting the supply of healthcare to shift to the Japanese model, where it's like, come on in, you've got qualified doctors and nurses, come on in, enter Canada, enter our market, our existing trained staff that we have that we lose every year. Let's encourage them to stay in Canada, open up a surgical clinic or a hospital or whatever, stay in this country instead of leaving. And then we could start to see our wait times go down.
Well, that's the disincentive here in Canada, because, talk about US and how, a lot of Canadians don't like the way it is down there. It's not a case that the hospitals are bad, that they're US has some of the most state-of-the-art stuff. It's probably on par with a lot of hospitals in Japan, because they're as well very state-of-the-art and with great staff. We just keep losing our staff to the United States. It's too easy. It's a country that's right there shares the same languages that we speak here in Canada. We largely, if you have a medical profession here in Canada, it's pretty transferable. So when nurses and doctors are being treated terribly in our system, I mean, it's hard not to. It's hard not to look at the situation and say, throw your hands up and say, well, I might as well just move to the United States. I can work for a hospital down there and I'll just do fine.
Yeah. Yeah. And it's, you know, we actually, as an organization, we've gathered data on the number of licenses handed out by, you know, select US states, including the border ones, to nurses and doctors with Canadian mailing addresses. So it gives you a bit of a glimpse into how many Canadians are interested in getting their licenses to work across the border. In the case of Michigan, it's kind of unique, but it worked out really well, where from Michigan, we could actually survey Canadian nurses, like nurses that they have gained licenses in Michigan, but they have a mailing address in Ontario. We could then survey them and say, okay, so tell us about your situation. Like, are you actually living in Canada, but, you know, using this license in the States? And from this, the long story short is we were able to calculate there's almost 2,000 nurses in the Windsor area that get up regularly and leave Canada to cross the border to Detroit and work in Michigan. And it's a crazy number when you think about it, just how many people that is that could be working in Canada. And I don't blame those nurses for a second. You know, they're what everyone does, right? When you think about your career and what you want to do, you look at the best option and usually you pursue it, right? But what's interesting is when we surveyed them is that the number one reason why they're working in the US is it's not money. I mean, intuitively, you might think, okay, they're going there because they're going to make more money. It wasn't money. It was the availability of work. And, you know, they wanted full-time work with predictable hours. I mean, go figure. They want to be able to plan their lives, right? And long story short, the working conditions and the availability of work, those were two of the top three reasons. Money was actually number two, the compensation package.
But okay, now you're opening up the door to more questioning here. Obviously, like if we're having shortages and emergency rooms are closing all over Ontario, southwestern Ontario for that matter, why is there shortages of work for these nurses? I mean, you'd think that they would be clamoring for people who are qualified and can work in these situations.
So what they were looking for was full-time work. So often what happens with nurses is the government-run hospitals, I mean, the government controls most of healthcare in this country. They give them like part-time hours or something, and then they're constantly having to chase after shifts. So when you're constantly chasing after shifts, it's pretty hard to, you know, plan your life around that, right? So they wanted like a full-time employment that came with benefits and predictable schedule, you know, what a lot of people actually want, right? And so they couldn't get it from Ontario, so they ended up deciding on working in Michigan. But it's interesting when you talk with these workers. I mean, they like the idea of working in Canada, but when you have the government controlling the employment opportunities, you don't really have a lot of choice, right? So when you do have a more robust system like Japan, where there's multiple different providers, they're trying out different things, they've got different arrangements, you're giving workers more choice, right? So you've got a greater probability as a worker when there's all kinds of different employers that one of them will offer you what you would like that fits well for your life.
I'm still very confused on this, though. So you have to explain this to me, because the government is one of these things where the government is a monopoly of everything, a monopoly of force, the monopoly to print money, the monopoly of resources. Why wouldn't it be that they could just say, okay, well, we have this many full-time nurse staff and just make it work for them?
It's a good question. And it gets a bit beyond sort of my knowledge of the intricacies of sort of what has been negotiated between the union and the government over the years. But I think the end result is that if you think about it from the employee perspective, you don't really have a lot of choice if you're a nurse in terms of where you're going to work in Windsor, right? You've got like a government hospital, or maybe the other government hospital, which is connected to the first one, or whatever. Maybe there's the odd private clinic or whatever, they have a nurse. It's different than, say, across the border where you've got a whole bunch of different choices. So when I come back to like Japan, where you've got government run hospitals and clinics and that, then you've got nonprofit, and then you've got some private ones. Well, now you've got a whole market full of all kinds of different employers to choose from. And that's what you want as an employee. You want to have a lot of choice, because it's a greater probability that one of them will offer you what you want. So in the case of government in this country, we got to remember that they ration healthcare. And so they decide how much money they're going to spend at the beginning of the year, and they dole it out. And then that's usually the end of it, right? Unless you have something like a pandemic come along, and then they change their budget or whatever, right? But it's all sort of done through rationing. A lot of people don't realize this, but when it comes to surgeons, they often have the number of hours that they can actually operate in an operating room. That's rationed. It's controlled by the government. So the government decides, well, you're not going to be able to, do this many hours. We're only going to pay for you to do this many. So then you end up with surgeons kind of, twiddling their thumbs a bit because they don't have enough work. And, Brian Day, Dr. Brian Day from British Columbia, your province, he ended up in a pretty lengthy Supreme Court battle. It's pretty interesting for people if you want to learn more about this. I got his book. It's not down here. I've got it.
I'll have to link the episode. I had him on to talk about it.
Oh, okay, yeah.
Yeah.
If you'd be familiar with this, but he talks about how like there have been problems in the past where like surgeons have been concerned that they're not getting enough operating time to keep up their credentials, because you can't continue to be a surgeon if you're not doing enough hours regularly.
Right.
So, it's a big problem in this country where you have constant rationing by the government in terms of how much health care they will provide to the masses. So you end up with the government kind of deciding, well, this is how much we're going to do this year, and the rest of you can sit and suffer on waiting lists. Like no other country would do this. So it's awful. Like I said, Japan, night and day difference, culture shock, going there and hearing again and again that, no wait times, get you in right away, or like maybe a week, 2 weeks. And I don't really think of that as a wait time.
Hardly from what we're used to here.
Country when you got people waiting a year, 2 years, or whatever. But the other benefit related to this, Clyde, is that it's not just that our country rations access to healthcare. Like we'll give you knee surgery, but you're gonna have to wait a year. We've decided that. It's not just that. It's the types of treatment that the government rations, where they will just sometimes they will choose the cheapest way to help someone. So I've heard this from multiple people that have worked in the system, where they will describe, well, look, if you have a particular health problem, there's more than one way to treat it. You've got the cheap way, or you've got the expensive way. The cheap way ends up with, obviously the government saves money, but for the patient, here's the problems. You may end up being, down and out, like recovering for a longer period of time, right? Whereas the expensive route, you may be back at work that day, kind of thing, right? So the government decides, well, you're going to get the cheap way, and that's it. You don't get the choice. So the government takes that right away from you as a patient. There's a former employee with Alberta Health Services who described to me how, you can do hip operations differently. Where number one, you can have like a generic prosthetic piece or whatever put into you, or you can have more expensive types now where they're like custom fitting. They're like designed by lasers or something or whatever. I don't know.
Right.
Or, some kind of special custom piece that you can have put in. Well, guess which one costs more, and guess which one the government chooses not to do, right? I mean, we know the answer. But then even when you put it in, there's different ways you can do this procedure. One is more costly, one is more is less expensive. Again, you can just figure out which one the government goes for. So the government takes a lot of our healthcare rights away in this country. When you look at models like Japan and, like I say, Sweden and France, patients have more rights, they have more choice. The system is set up around them, whereas in this country, it's more set up around special interest groups.
Right. I should be able to buy a Ferrari if I want to waste my money on that thing. I want to be able to. I want to get the more fancy thing if that's my cup of tea. Yeah. Or I want to have the choice to buy the cheaper service because I want to spend my money on other things.
Yeah.
That sounds reasonable.
It's crazy too. Like you could take your whole paycheck and dump it on, vodka and fast food and like, cigarettes, whatever, all kinds of things that are bad for your health. And you can do that, but if you want to use those same dollars to try and improve your health, the government's like, no. Like, wait a second, you can't pay for a private hip operation. Like, it's crazy when you really stand back and think about how our system operates.
That's an interesting point, because here in Canada, we have what's essentially catastrophic care. Anything other than that, you might get through benefits through your work, possibly, or that's even sometimes limited coverage. And going to see a nutritionist, like someone who can tell you what's better for your intake, what you should be eating, what kind of nutrition works with your body type, what kind of maybe physiotherapy for something that was a previous injury, but you want to be able to work your way through it so it doesn't maintain as being an injury and then become something worse later in your life. It seems like we don't have much of a maintenance schedule when it comes to people's health, and it doesn't feel like our medical system is geared towards even offering anything like that. Where in Japan, I know that even through work and through the medical insurance, they want checkups. They want to see how you're doing.
Mm-hmm.
And they're actually keeping tabs on what condition your body's in.
Yeah, and that's a fundamental difference between their country and ours, is that our system is largely focused around kind of dealing with the problem, right? Once the problem has arisen, here's how we're going to deal with it. Oh, okay, you've just had a heart attack. Okay, let's, here's what we're going to do, or whatever, right?
Like chronic issues, yeah.
Yes, yeah. There's all kinds of examples, right? I mean, even if you're in poor health, it's going to affect how often you go to your family doctor, even, right? You're going to get, your immune system's going to get weaker. You're going to go and see your family doctor more often. I mean, this was evident during COVID, right? I mean, it was pretty clear if you had an unhealthy lifestyle, you had a greater probability of getting hospitalized for COVID and so forth, right? So the government focuses around like sort of like, okay, let's deal with this person now that they've landed on our doorstep. Whereas you're 100% right. This is something we talk about in the documentary too. Is in Japan, it's the opposite. Go figure. Again, it's the opposite. They're trying to work with people so you don't get to that point where you need those costly procedures. So, I mean, you would probably know this from your time there, but it starts at a young age in Japan, right? Even just in schools. I taught English there, and I can remember, maybe once or twice where kids would get in trouble because they were bringing in junk food to schools, and it just was not allowed. It was a serious problem there. You don't have vending machines in schools, right? Like they have nutritionists in, I think it's the elementary level, where they'll work with kids because they're trying to get people off on the, start off on the right foot. Here's how you can live healthy. Here's how to make healthy food and so forth, and get them thinking about that. It's not that there's no junk food in Japan. Obviously, you can get junk food here and there, and people have it, I think, more so for like special occasions than in the Western world here, where it's like every day, right? More people will have, junk food and make decisions that aren't quite as healthy. But it's not just diet. I mean, the lifestyles are different there in terms of exercise, right? They have such a sophisticated transit system, and a big part of this is because they have a large population of small areas. It's very conducive to having a very complex transit system, but that ends up resulting in people walking more, right? You walk to the train station, you sit on the train, takes you to the next stop or wherever you have to go, and then maybe you have to transfer and walk to the other train line and get on it, or you eventually get to the stop that you want, and then you walk from there to your place of employment or whatever. So you're getting in more steps and walking and exercise, which you can't necessarily do something about that in a city like Calgary, for example, where I am, where we got lots of land. We don't have to worry about that, right? And you can only have a transit system that is only so robust because people like to have their cars and so forth. But the bottom line is that in Japan they spend more time on prevention. And I liked your comment earlier about how you can spend $1,000 in a day or whatever and get all these different tests done. I mean, they encourage that. They call it human doc. And I wasn't aware of this term when I lived there.
So people don't have to pay that $1,000. I was paying that as a Canadian coming there, not paying premiums to the system. So a lot of times these tests, they'll actually be required for your work. So there's a lot of companies that will say, okay, every 2 years you're going in for one of these tests, and you sit there, you get paid for the day, and you go in there for the afternoon and they do a bunch of tests on you.
Yeah.
And then they tell you how you're doing. And for them, it makes a lot of sense because the company's giving you added benefits to the medical that you already have. But they're paying premiums. And if they have healthy members of their team, then their premiums will go down. And this makes a lot of sense.
Yes.
So it's not all socialism, right? There's a universal medical aspect to it, but then there's also a business aspect to it that makes sense, and it drives people to be more healthy.
Yes, yeah. And that's their thinking, is that we're going to try and meet with you regularly. I think it's like once a year. Is kind of what I've picked up. Maybe you picked up something different, but it's, you do it not too often, but once a year you check in. I use the term human dock. They think of it as like a ship, a naval ship docking once a year, and someone inspects it. The ship goes through repairs. Or they think of it as the same idea, except it's a human docking into the health system. They check it over, right? Like you're having all kinds of tests done and whatever. It's not like in Canada where you have like, typically like a short, maybe half an hour visit with your family doctor, and you go over a bunch of stuff, and then that's it. I mean, it's a longer period. You get lots of tests done. They're trying to catch the cancer early, work with you if you've got, other health problems or things in your lifestyle that aren't healthy, to try and work with you to figure out, okay, this is what you could do differently. So I think that is a very significant difference between their country and ours, is that their population in general is healthier to begin with. So it's going to put less stress on the healthcare system.
There's the other thing there that's a cultural thing, and that's fat shaming. It's still allowed. You'll get your friends saying, I see you put on a couple of pounds lately, and they'll give you the ribs over it. People feel a little more comfortable about that. One thing I wanted to add though, because I know a lot of people are liberty oriented that watch this channel, and they're worried about privacy. Like, yo, I know you want me to get my health checks, but I don't want you to know all my details. My work shouldn't have all of that. The other part about this that I know of is that everything's confidential. So there'll be a report that they provide to you that tells you all the details. But then for your employer, it's just a bing, bing, you get a little check mark. That's an okay bill of health. So like people are worried about that stuff. Like, I don't want my personal information to be out there all over the place. I would say the Canadian government's probably not the safest place for all of that either, but it is what it is. Absolutely.
Yeah. So they actually have a program called Metabo, and this started, I think it was around 20 years ago now, maybe not quite 20 years, but it's been in place for a long time. And it is shocking coming from a Western perspective, learning about it. I mean, you talk about the sort of employers and what they know. So with Metabo, they will have, I think it depends on the size of the workplace where you're working, but they will have like health staff come in and they measure your waistlines once a year at work. And it's like, so you hear this as a Western, it's like, what? Like, I mean, this would not fly in Canada as a policy for obvious reasons. Canadians would just react to this idea of like someone coming into their workplace and measuring their waistlines. But, we talk, actually, we have a second video coming up where we kind of explore this a little bit, but we talk to people in Japan, like, what do you think about this? And they're kind of like, yeah, it's, it's kind of weird, or it's too much or whatever, but whatever. It's kind of like a shoulder shrug. Whereas we would have riots in the streets here in Canada if someone suggested that, the government medical staff come in and measure people's waistlines at work, right? Like, but it kind of, this one lady we were talking to, she kind of helped really position it for me. And that is, the concern is it's very much about your health. Whereas here we would kind of view that as sort of like, it's embarrassing to you, but they would rank, your health higher than, potentially being embarrassed or, offended by it, whatever. So that's why they do it, is right. They're trying to keep people healthy and encourage healthy living. So, I think for us as a nation, we should be spending more time on preventative healthcare, thinking about how we can maybe, as you talked about, thinking about this from a liberty perspective, you don't want to have the government interfering in people's lives. So you got to be careful, but maybe there's some things we can do where we can kind of give people a gentle nudge towards healthier living so that the system doesn't have to pay for these huge costs down the road. So when it comes to preventative healthcare ideas, I mean, maybe we don't look at Japan for that, but there are some interesting ideas from other countries where they're doing some things to try and help people. I think of Sweden, where it's a voluntary program where they will give patients a physical act, a prescription, a written prescription for exercise. And they will even help people come up with like an exercise plan, because they're trying to look at prevention, but it's entirely voluntary. So no one's forced into anything there, but it's kind of a different approach from Japan, where you're getting your waistline measured at work, which, wouldn't be a policy here for Canada.
Well, so it's a contrast compared to what Canadians' interaction with the medical system is. Some people have more interaction with the medical system. Perhaps they see their family doctor from time to time. Mm-hmm. But I would say a big chunk of the population in Canada, their experience with the medical system is either they're going to walk-in clinics and then getting referred, which is hard to get even at that point, because you just want to see a doctor for something specific. You don't know where to go because you don't have a family doctor, or you're going to the emergency room. And like, these are not the ideal places to be going for these services, but this is what people have access to.
Yeah, you're right. 100%. It's a big problem. And if you're going to your, and I haven't had to do this, but I've certainly heard this. If you've got knee problems and they're serious, and you don't have a family doctor, you're going to a walk-in clinic. Well, now it gets hard because, the walk-in clinic is going to refer you to the specialist, and then the specialist is going to have to like send the results back to typically a family doctor. But if you don't have one, then the walk-in clinic might be like, well, we're not handling this, and then get patients in limbo. But yeah, it's certainly, I think, important for us to be improving access to family doctors for people. But in Japan too, you can. I think the cases kind of differ, maybe where in Japan you live, but we certainly heard of the ability of patients to go straight to the specialist. Like, if you've got a serious knee problem, and you got something wrong, why go to the first step when you can just go to that next step? Because that's really where you need to start. Your family doctor is going to look at you and hear you out and go, yeah, okay, you need to go to see the specialist. Well, if you can skip over that, I mean, maybe that's something we need to look at too in this country to help improve access to healthcare for patients.
Well, I'd like to see some improvements anywhere. It would be appreciated. That's largely the case here in Canada. But of course, I want to showcase your documentary, because amazing work you've been doing here. People can go check this out on YouTube. The YouTube channel is secondstreet.org, or secondstreet.org, because the website's secondstreet.org. I'll have links in the description down below. You can go check it out. A link to this documentary, but there's some others. Make sure you subscribe to the channel. But then after that, make sure you head on over to secondstreet.org and you can check out all the work you guys have been doing. Anything up and coming that's worth noting?
Nothing huge. I mean, we're always churning out content. I mean, I mentioned, sadly, we do those diet on a waiting list reports each year. I mean, we're in the process of gathering that data. And we're just trying to show Canadians, like, draw attention to this problem. And it's so awful in this country. We need more attention on healthcare, specifically just governments copying more policies that work well in countries like Japan, Sweden, France, other European countries. So that's really what we continue to try and do, is just put out policy ideas and solutions, be constructive, and show people the consequences of the way the system's set up now. So really appreciate the conversation with you, though. I mean, the more people learning about healthcare, the problems and solutions, the better, because that's the only way we're going to get this thing turned around in this country.
Colin, thank you so much for joining me today.
Thanks a lot, Clyde.